Here, I'm going to show you the maternity course schedule. So week 1, we're supposed to talk antepartum care, right? And also when we're done antepartum care, you have to sit for the quiz number 1. So antepartum care, the chapter have discussed in the sender book chapter number 24, page number 289. When you've done the PowerPoint or sender book, you can practice the question from Evolve. So it is practice NCLEX question, antepartum question from Evolve. So, and week 2, it is date here, 038 means next week, and 2022. Antepartum, rest of the part we will be discussed, and sender chapter 24-25 same, and practice question from Evolve. And next, week 3, we're supposed to talk intrapartum care and quiz 3, sender chapter 26. Week 4, intrapartum, rest of the PowerPoint, and practice NCLEX question from Evolve. So the student who have sender book and they have also Evolve online 4,000 question. As I told you, sender book page number second page or page number 2 have a barcode and also online link. By using it, we can open Evolve online account. I will show you. Week 5, we supposed to talk postpartum. Date is there. Postpartum. Sender book chapter 29. Week 6, date and postpartum complication only. And quiz 6. Sender chapter 30. Also practice questions from Evolve. Week 7, date and newborn. After this, we have to sit for the quiz number 7. Sender book chapter 31. Page number also there. And week number 8, date, you see, next month, 19. Maternity and newborn medication one day. Then quiz 8. Also, we will review the summit review videos. We have 3 videos we call Summit College videos. This is complete. It is very good for the student. Student can learn so many things from here. And also, we test yourself in Maternity Evolve as a preliminary exam. And then last week or week 9, we can sit for final exam. So this is basic talk about the timeline or class schedule that we're supposed to follow these 8 weeks. Syllabi. So here I'm going to share with you the maternity newborn nursing course curriculum or course syllabi. So this is the title, maternity nursing. The course code is anywhere 107. It is 3 credit hours, 45 clock hours. So maternity newborn nursing is designed to familiarize the student with holistic approach to the care of maternities or obstetrics. As I told you, maternity and obstetrics or gynecology and obstetrics. Gynecology means the female disease that is related to the uterus, ovaries, cervix, right? Or any kind of menstrual abnormalities or genital organ cancer. But obstetrics means dealing with the delivery. And we categorized this antepartum, means before delivery or preparation period. Intrapartum means the process of delivery, and postpartum, after delivery of the baby and delivery of the placenta. So maternity or obstetrics, we categorized in 4 parts: antepartum, intrapartum, postpartum, and newborn care, right? Normal process of conceptions, fetal movement, labor, delivery, postpartum period, and family involvement will be included in gynecology or obstetrics, right? So, as I told you, the course include the care of normal patients and newborn, as well as those with complications. My friend, here I'm just talking the introduction today. And this introduction, because we are working together and this is first day of maternity, at least I have to explain what is my course curriculum, what is my syllabi. I already have emailed you. At least you know what is we are going to do. We work together, right? And we will finish one. The course objective said, apply the nursing process. Nursing process about what? About antepartum, intrapartum, postpartum, because it is the maternities. Apply the nursing process in care of the neonate. Identify potential complication about mother, about newborn. Identify potential complication of the newborn and outline the nutritional need, and also recognize influence of family, culture, spiritualities. So we actually provide the services to the patient. It would be holistic, means complete care, right? So next, what are the instructional delivery plan? My friend, you're supposed to read it. I said I emailed you. You have to go through every sentence. If you agree, no problem. If you disagree, you also welcome. Come to me, text me, phone me. I will explain more. So basically, we are, as I told you, we work together. It should include clinical, lab component. So clinical means after you finish this 8 weeks with me, I will forward your application for nursing leadership and community nursing, and then you can contact with school for clinical rotation. Usually clinical rotation, we have a collaboration with local hospital, rehab center, acute care. Students are allowed to go. Also, beside of this, we have simulation lab at the school. Students can learn so many things from simulation lab that they are not allowed to learn from hospital, but both is important. I appreciate students should learn from hospital, students should learn from simulation lab. So we have a very skilled instructor, They will help you how to adjust insulin, how to mixturing insulin, how to dose calculation, how to adjust the IV saline solution. Also, they can help you to bed making or patient care, vital sign measurement, input output chart maintenance, right? So all is important. So here the provider activities essential to the basic practice of nursing. The student will be provided opportunities to implement the nursing process to direct the patient's care, right? So you basically learn some skill that you can apply in your professional life. So what is the clinical objectives? We have an aim. We will try to make it up, right? So all the times it does not necessary you have to fill all 100 to 100, right? So, but we will try. Demonstrate the professional standard. We always try to maintain it. Otherwise, my school will lose the license, right? And when I work in the hospital, I have some responsibility to my patient. This responsibility is not only for the authorities, not for the money. It should be come from my heart. So professional standards should be moral, should be ethical, and legal conduct. So ethics or principle of ethics is important when you work. Demonstrate professionalism. Very important. Professionalism should include attention of appearance. Like I work as an RN in my floor. Tomorrow early morning, I have to go. And before to go, I just text my manager, I can't come, I can't go, I'm sick. So it is not professionalism, right? So I gave my word, if I'm okay, I'm supposed to be there because it is very serious profession. Today go, tomorrow not go, day after tomorrow again go, again not to go. So it is not a way, right? So we are RN, but I have to be a good looks, look like the healthcare provider, right? There are not so many bracelet or too much ornaments, right? Also respect for self and others. If I respect others, I will get it too. Attention of professional boundaries, very important. So you act like a way, you help to your patient, not too much, right? So with the patients and family as well. But when you work in the hospital, if you too much carry, they will fall in love with you. If you little bit neglect, there's so many angry group. They show their angerness towards you. Sometimes they do very rough behave with us, but still we should adjust with it, right? Implement holistics, complete care, patient-centered care. So whatever we do, it should be patient-oriented. It helps my patient to feel good, to feel their needs, and reflect of understanding of ethicals and legal issues. Right? So communication is important. Communication is important to my patient. Communication is important even I'm talking with you. So can you understand what I'm talking? If you do not understand, it's my fault, not your fault. Means I do not know how to carry out the information in your brain. I'm trying to print something in your mind, but I failed. So I have to learn first. So when you deal with the patient, you explain, but your patient do not understand anything. So means the communication is lacking. So if communication is not work, ultimately the output should be 0. So pathophysiology of the disease, we will try to understand what it is. Pharmacology of the treatment means what are the medication my patient need? What are the side effects of the medication? So if I do not understand the side effect, how I will educate my patient. Medical management of the patients in the labor, because we are talking about the maternity. Nursing process management before and during and after giving birth. Wonderful, right, my friend? So deliver the compassionate, patient-centered, and evidence-based practice. Wow, so it is very important. Evidence-based, we should love it. Every day we're doing something and we are learning something. And when we compare and contrast which one is the best, apply it for the next. So I learn from my experience, I use it for my patient to improve the qualities. It is evidence-based care. So create a safe care environment that result in a high quality patient's outcome. Also demonstrate this critical thinking skill. Wow. So you see, my friend, you get your diploma, you have the license, but your brain does not work. So you have to know how to coordinate between what you learn from the school. When you're dealing with your patient, get the history from the patient, get the laboratory result, and you have to coordinate all of them. Then you make a plan. What is my patient problem? It is called nursing diagnosis. Your brain is working, you know how to coordinate, right? And you can apply your anatomical knowledge, physiological knowledge, and what are the pathology of the disease? What are the diagnosis? And what is the best for my patient? If your patient say, I have a shortness of breath and cough. Okay, you say, oh, my patient says shortness of breath and cough mean respiratory problem. And you learn when patient has a shortness of breath with cough, it is productive or not. Also, wheezing is there. When you put the stethoscope, you decide my patient has a bronchial asthma. If patient has a bronchial asthma, patient position should be high furler. Give them oxygen if need. Because if patient has COPD or asthma, oxygen is very important to maintain. So your brain work, you coordinate, and this is called critical thinking. So demonstrate application of psychomotor skill for the efficient, safe, and compassionate delivery of the patient care. Monitor the client outcome to evaluate the effectiveness of psychobiological intervention. Collaborate with other healthcare professionals, patient to provide appropriate health promotion, disease injury prevention and intervention. You see, everything is there, nothing we miss. So what we miss from these two sentences? Nothing, right? Collaborate with others. So right, you working in med-surg unit. Your patient need a chest x-ray in radiology unit. You have to communicate with other faculties. You are working in cardiac step-down unit, and suddenly you feel your patient EKG is changing. You call to the doctor, means you communicate with the healthcare professional. Provide appropriate health promotion. And also you have to know how to prevent the injury, fall. Next, go. Instructional delivery plan. So formal will include lecture. So what actually we going to deliver to you? We give you PowerPoint, we give you some assignment, some quizzes, right? Some note, and finally you will pass the exit exam and go for the board. But first of all, here I want to share with you, we have to provide everything to you. You are the student right now, and we have a school. School can give you PowerPoint, school can give you the exam or quiz link, school will give you what videos you need to learn, right? Your instructor is supposed to do this. Every instructor is supposed to do this, their responsibilities. If not, just let us know. We will educate instructor as well. So we are learning every day. If I do something wrong, I will ask my CEO and I step me up. Every instructor also work like this. It is a teamwork, basically. So we have online materials, classroom assignment, activities, reading, right? So what it is and how we get it, basically what we follow. We follow the Google Classroom, everything is there. Also, sometimes some video we recommend to the student from YouTube, but we will tell you what you need to know. YouTube is a good tool, but not that much good to get a complete preparation for NCLEX board. We will give you the direction. Instructor and student responsibilities, right? So instructor is supposed to teach you, educate you, and your responsibility to complete the quizzes, complete the assignment, and watching the videos, make a note. Your instructor will give you the case study. You have to write a note on it. When you watch the videos, and you have to make a note on based on that videos. So it means my student watch it, they learn, and they make a note. And you email me your note, and I will check it. Right? So include in these obligations necessary of meaning timelines for complete of activities, assignment, and test. Students who need additional help, don't feel hesitate to contact with us. We are always happy to help you, and should notify instructor who will provide additional assistance, right? Also, your student can directly contact with program directors. So course requirements and dress code. So it is actually important when you come to the school for clinical rotation, that times you have to follow the dress code. If you read it, you can understand. I believe I do not need to go through every line by line. What dress code you have to follow. Also, method of communication grade. If you miss a test, how will continue it? Attendance. So when student get in the classroom, they will get a credit. And also you have to have 80% class attendance. Class participation. Class participation is an expected behavior to minimize the student learning. All assignment must be completed before class. Students are expected to actively participate in class by performing the skill under supervision by the instructor. So I believe you do not need remediations. Why? I believe you will do everything in one sitting. And if students complete the course from my school, and school can send their name to the Board of Nursing, they can sit for licensing exam. Most of the students will pass their NCLEX board in one sitting. If any student will not pass by the first time, they will make it by second time. If any student will not pass first, second, third, that unfortunate student have to come back to the school for remediation. Students who are not meeting the course objects or requirements are expected to practice in nursing skill laboratory or look for assistance of a tutor or their instructor. It is the student's responsibility to make an appointment with the course instructor for directions regarding the remediate. Now, nursing skill and nursing skills laboratory. So students are responsible for assigned the reading the textbooks. So you say, nobody can help you without yourself, my friend. So if I talk 4 hours, but you do not study, I believe nothing can work. So other assignment prior to lab or participations in discussion over assigned materials is expected. Student must adhere to the clinical dress code for skill laboratory session. So it is actually when you come to the school, don't get panic right now. It is in future, not now. And next here, clinical experience. Clinical attendance is mandatory. Immunization, CPR, TB status must be current for the student able to attend the clinical. So actually every student have a own file. This file must be contain immunization history record, your medical record, your physical exam, also your driver license, social securities, your TB status, and CPR. I will talk about CPR today. Student will allowed to perform designed nursing skill in clinical setting, right? We can provide it. Students are expected to meet clinical expectations based on student learning needs. Faculty will determine appropriate amount of time and clinical assigned needed to assess the student growth. What else? Next, students are expected to prepare for clinical practice in order to provide safe and competent care, and clinical assignment must be handed in one time to the clinical instructor. So now here, method of evaluation, and here the grading scale. Let me talk a little bit about this. First of all, here we can see homework and participation of this 10%. Care of planning, when you write it and email us or submit to the Google Classroom, you will be graded. It is 12%. Quizzes 8%, midterm 20%, midterm 2 20%, final exam 30%. So all of this you are able to get in your account in Google Classroom. Today, I will show you where actually midterm 1 to 3. But my question here, today we are in the level 1. So, but if you check your Google Classroom now, you will not get the final exam today. Final exam, we will upload it before final exam. Means like final exam, the week 9. So you will get it during the week 9. Week 8, you get midterm. So when time will come, we will submit it in Google Classroom. So once at a time. Grading scale said, if you get in between 90 to 100, you will get A. If you score in between 80 to 89, it should be B. If you score in between 79 to 75, it should be C. Unfortunately, if you score less than 75, below 75, consider failing grade, right? So you have to redo it. So grading policy also you will get in the student handbook. Every student have it. So you have to read. So first successful attempt 100%, second successful attempt 89, and third successful attempt basically 79%. So the following are the score that will be given on the scale. So now here we can see what are the books, materials students supposed to follow. Here we have some book list we recommend you can follow. But basically, I like to request the student to follow Center Comprehensive Review for NCLEX RN for RN student and NCLEX PN for PN student, right? When students buy this book, they are also allowed to use 4,000 online question. The course curriculum I already explained and also tell you this timeline, so you are able to get it. So now here say acknowledge of the syllabi. So means I already emailed you. You have to read it. I explain. You have to sign here, and you have to email me. So I will understand. I will realize you go through, you understand all of the materials, you signed means you agree, and we work together. So you can write your name, and I have, like, my name is Dr. B. I have received and understand the syllabi and contain the policies, right? What is required for maternity, and you are 1007. You have to signature, put your date, and you can email me. So now I'm going to show you Google Classroom content. I'm going to show you how to get the quizzes, and also I will show you how you can get the PowerPoint. But what I like to do it after my class, always I like to email students to my class recording, my PowerPoint, and also some important note. Students sometimes like it, and we work together basically.